There's a new call today for employers to put an end to asking for those sick notes. It's a practice that many doctors say puts even more pressure on a healthcare system already stretched for resources. CTV's Heather Wright is on this story. And Heather, what kinds of illnesses are we talking about?
Well, Sandy, we know family doctors are stretched thin. They are spending too much time on paperwork, including sick notes, time that could be spent treating patients.
A fever, the flu, a migraine, short-term illnesses that often lead to absences from work. But for some, staying in bed requires a doctor's note, a practice doctors want to see ended.
We want to make sure that our family doctors are available to Canadians to provide the care that Canadians need and Canadians deserve. And so if we can get rid of something that really has no medical benefit to anybody, but does add to the workload that family doctors are experiencing, that's a real win for all of us.
The Canadian Medical Association is calling for an end to sick note requirements for short-term minor illnesses, calling it an unnecessary burden.
There's 6.5 million Canadians who don't have access to a family doctor. And when we see that sick notes are taking up millions of hours of family doctors' time, this is something that's causing that to become worse.
According to a survey, about 1/3 of working Canadians say they were asked for a sick note for a short-term illness at least once in the last year. And 82% of those surveyed said they would rather go to work sick than get a sick note. Policies differ from province to province, and the CMA is calling for legislation to end the requirement. In Ontario, a bill to end sick note requirements is currently under debate at its third reading.
The CMA estimates doing away with sick notes could prevent as many as 12.5 million unnecessary health care visits every year. Sandy.
Thank you, Heather.